Very good. Well, I want to welcome everyone from around the world, and it's my great honor to introduce my good friend and colleague, Professor Bulent Koçyian. Just by way of brief introduction, and I promised him I would keep it brief. Bulent served as 6 years as the director of psychiatry for Turkey. He has been involved with the WHO projects in Turkey. He played a leadership role after the 99 earthquake. He has helped develop two psychiatric departments within Turkey, most recently in Kocaeli. Bulent has had a distinguished career as a psychiatric educator, as a clinician, with a focus on community-based psychiatry and really the team approach to mental health delivery. He's been a leader in psychiatric education in both the World Psychiatric Association as well as in Turkey. I've had the great pleasure of working with him on a number of manuscripts and a number of presentations over the years, and his personal commitment to psychiatry, his patients, but really to education and medical students and students from other mental health disciplines, as well as psychiatric residents, is really very noteworthy. It's my great honor and pleasure to introduce tonight's guest speaker, who really is the heart and soul behind SEED. He puts in so much effort to keep this thing going, and he's going to be talking about an area that he is very familiar with and very expert in, and that's the mental health promotion activities in Turkey. Professor Koçyian, please.
Thank you very much. Well, today I will be the guest speaker of SEED, and we'll be talking on intergenerational meeting as the part of intergenerational meeting on mental health promotion activities in Turkey. Just to start, I think I will first have a look at Turkey in general, then a brief touch on the concept of mental health promotion, then some examples on local mental health promotion activities. If time permits, one deeper look at activities after a devastating disaster, 99 earthquake. A general look at Turkey. Turkey has several unique characteristics and paradoxes in many aspects. Geographical terms, historically, and in sociopolitical terms. Geographical terms, Turkey is a bridge between two continents, and historically in between three continents. In sociopolitical terms, a secular country with more than 90% Muslim population, an insistent long-term candidate for European Union, a permanent candidate, and will not be any more than being a candidate. A rather young republic of 100 years, founded by Mustafa Kemal Atatürk in 1923, and it is the 100th, it's been a century now, built over an old empire of more than 600 years. Used to be one of the few countries capable of feeding her inhabitants by local resources, but unfortunately it doesn't go on like that. Now the country is struggling with one of the highest inflation rates in the world. I just want to show you doner kebab, which may remind you the taste of food in Turkey. Psychosocial well-being and issues on mental health promotion and prevention are other examples of paradoxes and harmony in the country. The still existing strong psychosocial solidarity in the families is almost in competition with the rapidly changing social structure. While there is the traditional caring attitude for the mentally ill, the elderly, and the handicapped, there is the tendency to turn the corner. It's a saying meaning that caring for himself or herself and no one and nothing else matters. Within this social context, there are several efforts of the mental health professionals to look into the complex problems and rich potential of the social structure. There are examples of collaboration with other professionals and people from other sectors: teachers, journalists, employers, policemen, people from NGOs. There are several programs for the improvement of psychosocial growth and well-being run at health centers, schools, workplaces, TV channels, public places, and also some programs are carried out at home visits, especially for the young children. In addition to these activities, there are many training programs for physicians, nurses, teachers, staff of armed forces, and for volunteers to improve mental health promotion. Now, a brief touch on the concept of mental health promotion. A quotation from Dr. Sartorius, he says, the words promotion of mental health are used to describe the reduction of the numbers of people who have mental health problems by appropriate prevention and care programs, an enhancement of mental capacity and greater ability to cope with adverse factors. Last one, lifting mental health on the scale of values of individuals and societies. I have also brought in a quotation again from Margaret Berry. She tells prevention, treatment, maintenance, and mental health promotion under 4 important subgroups: competence, resilience, supportive environment, empowerment. Now, I want to give some examples about the situation in Turkey. Now it's not the time to talk about global activities, maybe at another session. And national mental health promotion activities, I have been involved personally when I was working in the Ministry of Health as the director of mental health department. I won't go into the details of them. And now comes today's discussion on local activities. I will try to give 4 examples on local mental health activities, which I have been part of. Visits to community mental health centers with students and residents, learning together studies with general practitioners, monthly training seminars with various mental health specialists on crisis intervention and suicide prevention, and mental health awareness activities after a devastating disaster. I will try to talk on these under these 5 subheadings: observed problems, needs, proposed solutions, objectives, implementation processes, results, and suggestions for future. As one of the seed activities, we are trying to focus on suggestions for future activities. So I hope this may be useful for our young friends. Now, first, visits to community mental health centers with students and residents. Observed problem was clerkships in psychiatry are trapped in psychiatric wards. Almost no awareness about mental health services out of the walls of the hospital. So there was a proposed solution for this, observing the functions of one of the community mental health centers in Kocaeli, being together with the owners of the community mental health center, and having the opportunity to compare with the psychiatric ward participants. I especially said the owners because at those community mental health centers, the owners are the so-called patients, whom I believe are no longer patients, but the owners of the places or the facilities. Implementation process, spending a half day at the center together with students and residents, joining actively in the daily programs of the center, and receiving reports about the observations at the same place. I would like to add a few words about this receiving reports about the observations. I was asking our medical students to send me emails about what they have observed in those visits. And most of them wrote very positive feedbacks. And recently, about a few months ago, I resent mails to them and asked if those visits had an impact on their work as a physician. Some answered and said they are working in psychiatry. Others said it helped, those visits helped them to better evaluate, assess psychological problems. And that was indeed a good feedback for me. And the results, most of the students were pleased with the hands-on experience and to observe the positive results of treatment and to interact with patients living in the community. One of them would say, if anybody is afraid of mentally disordered people, they should be told that it would be best for them to visit the nearest community mental health center and to interact with people there. And suggestions for future, such easy and almost with no cost visits can be organized as part of clerkship and residency programs. For these, maybe the faculty members and also the students can ask for such activities. Now, the second example, learning together studies with general practitioners. Observed problems, the already limited knowledge and skills of general practitioners, GPs, are restricted only on treatment of severe psychiatric problems. And nothing related to prevention and promotion are discussed at the in-service trainings, sponsored by, most of the time, by the drug companies. And GPs are considered as passive learners, and their expertise are very seldom valued. Proposed solutions, planning together the content of the program in line with the needs, raising awareness in mental health, capacity building, and empowerment, an emphasis on promotion and prevention. And the most important part, learning from the GPs about their perspectives and their experiences. Implementation process, we had 10 working days in 2 months period spent at the, either the university facilities or the health centers where the GPs work. Having lectures from GPs for the students, residents, and the faculty members about their experiences in the field, and also having some exercises about mental health promotion in the field together with the GPs. Results, only 5 groups of GPs could participate in these learning together activities. All the participants enjoyed the learning together process, but the dream to extend these activities, unfortunately, could not be realized. Suggestions for future. Specialists, especially university teachers and the trainees, should search ways to learn from the GPs or family physicians, we can also call them, and try building the platform to share experiences for mutual benefits, not only teaching, but also learning from them. Third example is about monthly training seminars with various mental health specialists on crisis intervention and suicide prevention. Observed problem was a request came to me as the head of the psychiatry department and chair of the Community Mental Health Center unit. A request for a lecture was considered to be insufficient for an effective in-service training. And I told the health directorate that we should have some case discussion programs. And then new case discussion tools were needed, it was observed. And also administrators, both in the hospitals and the health directorate, needed to be involved in the process. Proposed solution was monthly meetings to be organized by the university with the support of health directorate. Medical students and residents of psychiatry department to be included. As it may be seen, in almost all those activities, medical students and residents of psychiatry department have been part of the process. Implementation process, participants joined from hospitals, prisons, from local directorate of Ministry of Education, and also administrators of the health directorate. Case discussions, role-playing, video recordings, analyzing the recordings, film and book discussions, guest speakers, especially from related with trauma, child psychiatry, ethics, law, and forensic issues. Guest speakers were invited to discuss those issues. During pandemic, meetings continued on online platform for about 2.5 years, and recently face-to-face meetings started again. The result, what can we say about the result? The old and new participants added value to the case discussions, and actually it is the only implementation of its type. I can also share an observation about these interactions. People coming from the prisons, the psychologists or social workers, were pleased to hear the activities of the clinicians working in the hospitals, and vice versa. The clinicians in the psychologists, physicians, or social workers working in the clinics were pleased to hear examples from prisons, also some examples from schools. And coming to the suggestions for future, similar groups can be established anywhere, in any country, any city, especially with the utilization of online platforms. Even international seminars can also be organized with almost no cost other than Zoom expenses. Coming to the fourth and last local activity, mental health awareness activities after a devastating disaster. You may all be aware of the February earthquake in Turkey, but in ’99, we also had a very hard one. Now, when we look back, this year's disaster was worse, has been worse. I understand that, but ours was also an important one. There were 17,000 people killed, dead, and more than double were wounded. 100,000 were displaced. And after the very first shock, people were in need of psychological support. But the decision makers, local decision makers, were after the loss of the buildings and physical problems. Most common problems among those in need of help, and also those supposed to help, was not being understood properly. If there would be a question, we can discuss this deeper. There were individual and group discussions with survivors, and we had noticed that at the group meetings, people had tendency to speak about the details of their personal problems and relations. First, a psychosocial solidarity unit was established in the first days. And instead of talking about personal problems in public, video clips from well-known TV serials and films would be used to talk about interpersonal and intrafamilial communication issues. Topics would be decided together with the audience. The meetings would be introduced as going through an exercise to increase awareness about emotions, cognitions, and choices in order to achieve better communication skills. There is a short video about these activities. I would like to share it with you as well. An implementation process. Meetings first started at informal settings, tent cities, or at any small meeting areas. Then more organized sessions came. Local and also the national media were interested in these activities. Meetings were interactive and there was an improvised approach. Participants were invited to take part in the role plays about the communication in the serials or films. And they were encouraged to consider possible alternatives for the choices of film characters in the video clips. And we were almost writing alternative scenarios. Of course, these were affected by the life events of the participants, but they were not mentioned openly. There was only projections to the people, characters of the films. Implementation process. Aim was raising awareness about communication skills. The number of participants varied from 20 to 70 or more. And there were 3 rules set at the beginning. There would be no talking about private details. If somebody would start saying, I had this, I would say, did, as given in the TV programs. And not accusing others, either present or not present in the talking area. We wouldn't let that because there might be some unwanted consequences. And we would have no political or religious issues to be discussed because that would lead to different areas. Most of the monthly sessions were video recorded with the permission of the participants for further analysis. It was observed that emphasizing the normality of getting help and observing the accepting attitudes of mental health professionals, I mean the facilitators, encouraged people to get help more easily. This was the observation of our psychiatrist friends who had private practice. They said, after your programs, people started coming to us more frequently. And several similar meetings were organized with different groups. Maybe this might be a topic for a different session. And we had feedback sheets collected at the ends of the sessions. Most of the participants enjoyed the sessions. Many participants said they were watching the serials and films with a different eye. Unfortunately, the negative side of this activity was an objective assessment of these activities could not be realized. And suggestions for future. Some similar sessions are still being carried out with different groups. Different tools can be used for similar studies, and it might be useful to try to assess the effectiveness of these activities in raising awareness in mental health. Just to summarize, visits to community mental health centers, learning together studies with general practitioners, monthly training seminars with various mental health specialists on crisis intervention and suicide prevention, and mental health awareness activities after a devastating disaster. Now, I don't think we will have enough time to go deeper and look at activities after that disaster. I should say thank you for your attention, and I would love to share the video as well. Now for your, I will stop. Now your comments. Later I will try to show the video.
Professor Koshin, since it's why not show the video now, and then we can have maybe right. First questions and then a discussion.
Okay, okay. Is it seen?
I can't see it. There it goes.
Sorry. Mental health problems of the hospital which was children. Visitors from employment or help us by feelings. Çocuk ilişkisi bazı örnekleri var. Başta oturup anlatmaya çalışacak savunmaya ondan biraz sonra I had black hair then. Let me add a few things. This lady passed away, was one of the characters in the game, in the play, and she and others came to Kocaeli to be with us. That increased our program's importance in the eyes of the participants. As you see, they were very young people and elderly as well. And the reason for some of the videos being green, I wasn't so keen in using the video recorder. I got the night shot, so it was green in some of them. Different ages shared their feelings. Yes, this is it.
I think the tape is over. I had a difficult time with the volume. I couldn't hear much, but I wonder if now would be a good time for anyone on the call, maybe to first have some questions or comments for Dr. Kostyan, and then maybe we can have a discussion on a number of the very important points he raised in his presentation. So maybe if we could first start with questions. And actually, even before we do that, I want to take just a minute to thank our WPA president, Professor Afzal Javed. He's got a very, very busy schedule and took time out to join us on the call. And I know Professor Kostyan and I very much appreciated his support for education, for global psychiatry, for global community psychiatry has been nothing short of extraordinary. And his actions speak louder than his words. So I want to thank him so much for taking time. And maybe if he had a few words before we even get into questions.
Well, thank you very much, Dave. And thank you, Professor Kostyan. It has always been a pleasure and privilege to attend these educational and teaching and training sessions. You rightly said in the beginning that Professor Bulent Kostyan is a star. He has really done a number of activities highlighting the importance of prevention. More importantly, how to promote and spread the message with the primary care physicians. And now with the students, he is doing a marvelous job. My only suggestion after listening to excellent presentation by Professor Kostyan is that WPA would like to know that how can we repeat and spread the great work that he has done in Turkey in other countries, especially low and middle income countries. It will be appropriate if Professor Kostyan and his group could really write some manuals, some modules that what needs to be done in terms of including this important topic in the curriculum for medical students. But at the same time, I know that there are some countries, although these are very few countries, that they are also working in school mental health in the non-professional medical institutions. I think WPA being a professional organization, and both Dave, you and Bulent are involved in WPA, we need to really tell the world that, look, this is how things can be done. So I do hope that in the future activities of this group, led by Professor Kostyan, we will be able to get some material to share and spread with others. Once again, many thanks. Well done.
Thank you so much, President. And the section that Professor Koshin and I work in, which is psychiatry, medicine, and primary care, we're really dedicated to this and focusing almost exclusively in low middle income countries. So we accept your challenge to have our section and our brilliant young students, the future of the field, work with us to develop some manuals on community mental health from an interdisciplinary, interprofessional perspective, engaging all of the stakeholders. So thank you so much. And again, thank you for your wonderful leadership of our WPA over these past number of years. Thank you so much. So any questions or comments for Professor Koshin based on his presentation? And then maybe we could have some discussion, because I think he raised some very important points, maybe where the future of psychiatry is going to be, not in psychiatric hospitals, maybe not even in the psychiatric clinics, but getting out to the community, that mental health and behavioral health should be and can be community-based activities, interdisciplinary, interprofessional. As Professor Koshin highlighted in his presentation, he spent his entire professional career in this area. So we need to all be teachers of our colleagues, but also learn from them. And I think one of the key issues that I'd like for us maybe to discuss and comment on is allowing people to feel like we want to be there to listen to their needs, not just to tell them what we think. This is something I've seen Professor Koshin do time and again over the 2.5, 3 decades we've done work together. He always begins by a question and listening. And I think that's one thing we hopefully all learn as we become psychiatrists. So maybe some comments and questions, and maybe some ideas on how we could take up the challenge that our distinguished president has given us, and maybe work on some manuals that we could assist training across the globe in improving mental health from a community-based perspective. So questions or comments that people would want to have?
May I say a few words?
Please, please.
I think there will not be much contribution. I should first thank Professor Javed for his suggestion and for his, as you said, Dave, being here among his so much heavy schedule. Thank you very much for being here first. And the other suggestion about producing some manuals, I think to have a positive consequence of what we have been trying to do for years would be something like that. I hope we can work on that together with our silent young friends, and maybe we can do something on that. Thank you very much for that suggestion.
Absolutely. Any questions or comments? I know we have just a small number on the call live. I know this is on our YouTube channel, so I'm sure many more will get a chance to watch it asynchronously. But any of the folks who are on the call now have a question or comment or some of your own thoughts. Again, we want to hear from you, our future leaders of the field. Hearing much, I'm going to take advantage of having President Javed on the line, and I wonder if you could share with the group, again, the YouTube channel, many more will view this, if you could highlight maybe some of the activities of the WPA. I know you have been a champion in this for not just your 3 years as president, but even before that, and maybe share with the group some of the activities going on. Again, I know you're far too humble, but I can say as a member, and I speak for Bulan as well, we're all so proud of the leadership that you've offered and really have really underscored the importance of the WPA in global mental health, not just our professional organization.
Thank you very much, Dave. I have prepared a report of all the activities which we will be releasing at Vienna. But I must say that, this last 3 years have really been a challenging years for WPA because of so many reasons, COVID, and then other situations, especially in Europe, conflicts, wars. My priority, there were few areas which I thought and which WPA has really worked over the last 3 years. The first and the topmost priority was that I believed that mental health should be perceived and practiced as public mental health. Because this is the time that we have to not only concentrate on treatment, but also on promotion of well-being and prevention of disorders. So I think this is one of the major area, and we have published a lot many papers, reports. I would encourage people to go to the WPA website and look at the WPA Action Plan 2020 to 2023. That will give you an idea about different areas where we have worked. The second area, which we concentrated, and again, we had a number of meetings, webinars, and publications, raising the importance of comorbidity in mental disorders. We are now living in an era where there will be a lot many comorbidities. And this is important for the future psychiatrists or future mental health professionals, that while they are dealing with mentally ill, they must have some background information that how physical disorders can influence mental disorders and vice versa, how mental disorders can have an impact on the physical well-being. The third thing which we tried to highlight was this medical students' involvement. We will never have enough psychiatrists. So the best approach, and which I'm really grateful to Professor Koskan that he is doing in his own way, that let's try to promote psychiatry among medical students. Just to give you an idea, first time in the history of WPA, we started travel fellowships for medical students. Last year in Bangkok, we invited people, medical students, to write an essay on stigma. It was amazing that we received hundreds of articles from more than 50 countries. And we offered a travel fellowship of $2,000 to the successful medical student. And we published the first 16 essays written by medical students, which is available freely on our website. This year in Vienna, we did the same. A competition for medical students on the topic of this physical comorbidity. We received plus 600 essays from 40 countries. So I think this is what I foresee, and I hope that WPA will continue investing in the medical students. So that was the third area. And then the fourth area, which we concentrated during the last 3 years, was interaction with our other professional colleagues, physicians, surgeons, primary care physicians, because this is, again, the time needed, and especially the theme which is emerging in the 21st century's practice of medicine, that we cannot separate mind and body. And we have to concentrate on our future generation, that when they are seeing somebody, they have to really see that person as a whole. So these were the few things, and we will be releasing a publication about the WPA work during this triennium, which will be obviously available on our website. But I think the only message and request which I would really like to extend to our younger colleagues, please look at the WPA website. Give us your suggestions. And you rightly said that they are the future leaders. They may be learning from us, but I think we have to learn from them. Because when you, me, and Bulent were trained at that time, the curriculum was different. The methods were different. Now, the methods and the curriculum is different. Needs are different. So we hope that we will be able to take their advice. They are our not silent partners, they are our active partners. And congratulations to both of you for really involving all these young medical students. Bulent has been able to make a great change in Turkey. I think we need Bulents in each and every country. Thank you very much.
I agree. Thank you so much. Thank you so much, Avso. Really appreciate that. I did see that we had some questions or comments from those on the audience. So again, I'm doing this on my cell phone in a dark closet, so I can't see. So people could maybe just chime in with a question or a comment, and please just jump right in.
Zehra would say a few things, I think.
Wonderful.
Firstly, thank you, Dr. Coşkun, for all your efforts for mental health. And I'm actually wondering what we can do to giving education before the disaster, because all of the crises and all of the bad events, we try to giving education and awareness after these events. But I'm wondering what we can do before all of this. And also, I'm wondering, is it possible to giving education about mental health, basic mental health, education for in high schools and the other young students to giving this education? And I'm wondering this. Thank you for your presentation.
If I may, please be allowed to reply to this question.
Of course.
I think Zara has said very appropriately and given a very good suggestion about school mental health, about mental health awareness among adolescents. I mean, as most of you know that 75% of mental health problems, illnesses start before the age of 25, 50% before the age of 15. So this means we have to concentrate on this population, not only for awareness, but also for the mental well-being. So for that, educationists will look at us, will look at the professionals, that how effectively we can advise them to include topics, themes, areas in the curriculum. And you mentioned about that, about the disasters. I think in the preventive side, the preparedness is the key word. Preparedness in terms of doing physical things, but more importantly, preparedness in terms of looking at that what could be the areas that could have an effect in a disaster, whether natural or man-made disaster. I mean, disaster psychiatry is coming up as a very sort of emerging specialty. So I hope that was the reason I was suggesting to Professor Coşkun and Professor Barron that we can always speak about all these things, but people will always ask us, give us some examples. So if we can say, look, here is a manual, here is a suggested module that you can use among your medical students, among your general students, very, very general, generic type of presentations. What is mental health? Why mental health is important? How mental health affects you? How mental health affects your relationships? So these are very small, short topics which are very, very important. We at WPA completed a project of preparing some modules about well-being among medical students. These modules are freely available on WPA's educational portal. These were prepared in consultation with medical students. So I think activities like this, we would really like to have your active involvement. Again, we produced a video, Why Psychiatry, and we took about 7 or 8 medical students from different continents. And we asked them, and they recorded that video, that why psychiatry is important from their perspective. I believe that your peer group will listen to you more. So you are our ambassadors and you have to really advise us what to do.
I couldn't agree more. In fact, I would even say that it's mandatory that we, high school or even before, when we think about kind of public mental health literacy, the time to get, and I actually believe, and I want to have Bulent address this as well, but I believe one of the silver linings of the COVID, which was a terrible global disaster, is the world now understands about being anxious and depressed and lonely. And it wasn't just something that crazy people get, but the whole world suffered from this. So I really believe that we have an opportunity. I know we've done this in the United States. We've had some grants, and we actually go down into the junior high schools and start talking about resilience and mental health literacy and quality of life. Not talking about just illness, but improving the quality of life throughout the life cycle, from young children all the way up to our oldest, most senior citizens. And I agree with Afzal that your generation, the current students, can relate to high school students because you've lived in social media and growing up with cell phones. That's not something that even existed when Afzal and Bulent and I were growing up. So we need to listen to you, hear you, and have you speak with a voice of authority on being cyberbullied and what can happen and with the internet. So together we can do something special and really address this issue of public mental health literacy, resiliency, and quality of life throughout the life cycle at a global scale. Bulent, what are your thoughts?
Well, you both have said almost all the necessary things. But I would remind Zehra that all the disasters she mentioned being prepared before it occurs. We know that all the disasters or earthquakes, we have one before and one after. After the disaster is always the previous time for another disaster. So what we experience from what we have gone through will teach us how to be prepared, as Dr. Afzal said, for future. And I fully agree with my dear colleagues that actually you, the young colleagues, are the key figures to reach younger population. You are not too young. You have younger citizens, younger group than you, so they would listen to you much more than would listen to us. IBK has also said a few things on the note. She says they should be integrated in political programs and curriculums in order to spread these programs to other people. Yes, I would agree with that as well, of course. Well, I know Dr. Afzal has to go to other places. I know it's too late for you, Dave. Thank you for being with us. If there is no more, we can hope the YouTube channel will work about this today's session in future.
Again, thank you, Bulent, for your preparation and presenting this very important topic. deepest thanks to Afzal for his words of leadership and guidance for all of us, not only as WPA president, but really for our field, and all of you who contributed. So thank you all. We look forward to next month's session. But now we have a task that we need to work on from our beloved and respected president to start working on this with our students. So thank you all. Have a pleasant day. In my case, a good night's sleep. And we'll look forward to seeing you all soon. Hopefully some of you in Vienna. Good night.
Thank you.